Good morning. I'm Amy Shuckley, Tulare County Supervisor representing District 3, and I'm the current Vice Chair of the Tulare County Board of Supervisors. I want to welcome you today to this joint press conference with our partners, including Mike Boudreau from the Sheriff's Office, our Sheriff, our Health and Human Services Agency Director, Tim Lutz, and two of our CEOs of our local county hospitals, Kauai Delta and Sierra View, who are currently seeing and treating COVID-19 patients. I want to make clear that we are here today because Tulare County is in a serious situation. We are experiencing a first wave surge of COVID-19 tests and hospitalizations. We are one of only 18 counties on the state watch list, which is why we have been directed to roll back the reopening efforts that we saw earlier in June. This rollback has been directed for 3 weeks, and what we do in these next 3 weeks will determine our immediate future as far as being able to dial up reopening or incurring more dial backs. So today, representatives will address the numbers, our health guidelines, and enforcement measures. So with that, I will introduce Tim Lutz, who is our Agency Director for Health and Human Services, and he's going to present the current situation with some numbers here in the county. At the end, we will be open for questions from the news media. Tim?
Thank you, Supervisor Shuckley. Good morning. Today, the Tulare County Health Officer signed a health order to implement the required rollback of indoor services at various business and entertainment sectors across Tulare County. The order is requiring the closure of indoor activity for restaurants, wineries and tasting rooms, family entertainment centers, movie theaters, museums, and card rooms. This is in addition to the closure of bars that went into effect earlier this week. We are asking businesses to comply with this order and the public to adhere to these guidelines. This action is necessary given the sharp increase in people testing positive for COVID-19 across Tulare County. It is necessary to save lives and ensure that there are sufficient medical resources to meet the increasing demand. The closures will remain in effect for at least 3 weeks, but may be extended if our local case rate and hospitalization metrics do not improve. Our ability to reopen these sectors is completely dependent on our community's ability to adhere to CDC and public health guidelines, including practicing social distancing, wearing face masks, and avoiding gatherings outside of your immediate household. As Supervisor Shuckley mentioned, we have with us today CEOs of Kauai Delta and Sierra View medical centers to discuss the status of hospitalizations and operations at their respective hospitals. The Tulare County Sheriff is here today to discuss actions his office is taking to help educate and inform the public about COVID-19 and promote adherence to the orders. But first, I would like to take an opportunity to highlight 2 key metrics that resulted in our being here today. This first graph is showing the case rate per 100,000 people in Tulare County. As you can see, following the initial increase in cases at the beginning of the pandemic, the county remained relatively stable within a range and at times decreasing. That was through May and into early June. Since mid-June, we've seen that case rate increase significantly with sharp increases this last week. On June 13th, we were at 160.2 cases per 100,000 people. Today, we are at 329.3, a 105% increase in a little under 3 weeks. This is an alarming trend that, if allowed to continue, may result in additional businesses and entertainment sectors needing to be closed, as well as impacting the ability of our schools to return their students to the classrooms. As of this morning, we have 4,627 confirmed cases, which is an increase of 106 cases from yesterday. In the last 14 days, we have seen 1,581 new confirmed positive cases. There are no significant outbreak locations or clusters that account for this steep rise in cases. From contact tracing and investigations, there is an indication that increases in gatherings that started in late May are a significant contributor to these increases. Also of important note, the largest percentage of the recent growth in cases in the county have been those 40 and younger, with the highest growth rate in those that are 17 and younger. No group is immune to this illness. Not surprisingly, as we have seen our case rate increase over the last month, so too have our hospitalizations. This chart depicts our hospitalizations over the last 3 months. And I should clarify, these are COVID-19 patients hospitalized specifically. As with the case rate, we remained relatively stable over a range through much of May and into the beginning of June. Since June 1st, however, we have experienced a 129% increase in our hospitalizations. The last 2 weeks, we have seen a 60% increase. Here now to talk about the hospitals and their response are CEOs of Cuya Delta and Sierra View Hospitals, Gary Erbst and Donna Hefner. Gary.
All right, thank you, Tim, and good morning. Thank you for having me here today. As Tim said, my name is Gary Herbst. I'm the Chief Executive Officer at Cuya Delta Medical Center here in Visalia. It's hard to believe that it's been 4 months now since Cuya Delta formally declared a community disaster and executed the hospital incident command system, stood up a formal command center, which to this day is still operated 24 hours a day, 7 days a week. In compliance with the governor's order, early on in the pandemic, we shut down all elective surgeries and also closed many of our services. Our endoscopy center, our lifestyle center, many outpatient services, all to create capacity within the medical center to prepare for an expectant surge of COVID-19 patients that we were all anticipating receiving, watching what was going on in New York and New Jersey and Louisiana. But that surge never actually appeared in Tulare County. When we thought it would be here in March and April, it really never came. But during that time period, during the early months, we still continued to take care of hundreds of COVID-positive patients. We admitted many of them, and sadly, we saw too many of them pass away. We also saw non-COVID patients that were unfortunately afraid to come to the hospital, afraid to come to the emergency department, and afraid to have many of their chronic diseases treated. So the hospital actually was very empty during the first few months of the pandemic in March and April. Our COVID positive inpatient census, pretty much the high water mark was around 35 patients. And with having so many of our beds empty for patients not normally coming to the hospital, that actually was kind of a positive thing at the time because it allowed us to accumulate personal protective equipment, which was in short supply. It allowed us to convert a number of our units to negative pressure units to be able to take care of COVID patients. And it allowed us to address many of the infection prevention processes and measures that we would need to put in place. Over the course of May and June, we actually began to witness and experience a significant slowdown in the outbreak of the virus, and we watched our daily COVID census fall. In fact, it fell to a level that it was generally on any given day. We only had maybe 20 COVID positive patients in the hospital. Also, that was good because we were starting to experience the return of patients that had stayed away. So while we didn't have a lot of COVID patients, we started to become a very busy hospital, and everybody was really excited to see that. We were always tracking the positivity rate, that percentage of patients that are tested for COVID that test positive. We were excited to see that it had fallen to 5.7%. Within the county, and like all of you out there, we started rejoicing the reopening of our society, the reopening of our economy, seeing restaurants reopen and being able to shop again in stores. We started doing elective surgeries again, and we opened up the endoscopy suite and a lot of services, and we were very excited to see that. But that all suddenly changed in June when we saw a major resurgence in the virus, and we saw a rapidly climbing positivity rate and hospitalization rate. Right now, today, we have 51 positive COVID patients that are in the hospital. Over this last week, we've consistently been at 55 to 60, which is almost 3 times what we were experiencing back in May, and just underscores the statistics that Tim was reviewing with you. Of those 51 patients, 18 are in critical care right now, either in the intensive care unit or the intermediate critical care unit. 7 of them are on ventilators. We are also, again, at the same time, taking care of hundreds of non-COVID patients in the hospital. And I look back again those early months, just March and April, we have almost 400 beds in the acute medical center, and we were consistently running an average occupancy of only about 50% of those beds that were full. So we were actually having to furlough and dock employees, even nurses, because we simply didn't have the patients for them to take care of. Today, this morning, our occupancy rate across those 400 beds is 90%. We only have 14 beds that are open that take care of respiratory patients, COVID patients, across 3 dedicated areas of the hospital. Unfortunately, we've had more than 150 of our employees that have contracted the virus, many of them the frontline workers that are taking care of these patients. Today, I have 50 nurses that are quarantined at home. I also have many other frontline healthcare workers that have gone out on leaves of absences because they were afraid to be infected by the virus. They had immunocompromised children or parents that they were taking care of. And so our workforce really has been decimated over this last month in particular. And I will tell you, they are exhausted. We're having nurses take care of many more patients than they normally would. You can just imagine what it's like being a nurse and you're all donned in masks and gowns and gloves and shields and bonnets, and you work your entire 12-hour shift that way, and you're going in and taking care of patients and spending 45 minutes to bathe and care for a patient, and you're sweating under all that PPE. At the end of the day, they're absolutely exhausted. But then I go to them and I ask them, can you work another shift? I'll pay you overtime. I will give you a $400 bonus. And many of them are saying, I can't. I'm just too tired. And so that causes us considerable concern that if this breakout of this pandemic at the level that we're seeing right now could really overwhelm the hospital, that overwhelm our physical capacity and overwhelm our workforce. So Cahuilla Delta is really desperately asking the community to help us, to help control the virus, to stop the spread, to stop the hospitalizations. I fully support, opening up our economy, opening up our businesses. It's been really, really hard. Cahuilla Delta is a business. And when you shut down, your elective surgeries, when you close all these services, it's had a devastating financial impact on our organization. So I want us to stay open. But at the same time, I want us to be as vigilant as possible in terms of wearing a mask when you're out in public. And when I'm at home with my immediate family, sure, I don't wear a mask. But when I'm at work, when I go to the grocery store, when I go to Costco, I absolutely wear a mask because I know the science works. And I look back again to that March and April when that surge never came that we were expecting. I fully believe that it's because we as a community, we as a county, did a phenomenal job of sheltering at home, of practicing social distancing, of washing our hands all the time, not touching our faces. We did just a phenomenal job, and you saw the fruits of that. And I realized to continue to do that for 4 or 5 months is exhausting, and it starts to wear you down. But you see what happens when we kind of back off, when we relax. This virus is as virulent as possible. I mean, never have we seen something like it. It is so contagious, and it always seems to pass from person to person. So again, I would just like to implore our community as we go into this 4th of July holiday, please be vigilant. Think about your fellow human beings. We ask you to wear a mask, not so much to protect you, although it does provide some protection, but it's to protect you from other people. And so thank you for everything you do as a community to support Cahuilla Delta and our healthcare workers, and enjoy the 4th of July, but be safe out there. Thank you.
Hi, good morning. My name is Donna Hefner. I'm the President and CEO of Sierra View Medical Center, and thank you for the opportunity to stand before you. As a lifetime resident of Tulare County, I am actually honored to serve in the capacity I do for each and every person that comes through our door for healthcare services. We, as well as Gary mentioned, are seeing the incredible surge. And although we have an incredible team of healthcare professionals that stand ready to serve for your healthcare needs, the overwhelmingness of the patients that we are seeing with this illness stands out, especially in this last week. And that's where the timing of this comes in with this press conference. Is although we've put systems in place to safeguard our employees and to safeguard those that are coming for our services, we are seeing this surge in the community that is causing people to become very, very sick. And so as though I stand before you, I'm asking for you to be part of the solution. I'm not here to tell you what you can or can't do, but you can be part of this solution. And that the solution, as Gary echoed, is doing the things that you have been taught. The science, as he said, does work. So we know that if we stand 6 feet apart, the likelihood of us being exposed is going to reduce significantly. We know that if we wear a mask, we are protecting others from us. So we need to practice these measures, stay out of crowded spaces and crowded places, and we ask that if you are in that circumstance, relocate. When I first started on March 11th, we were preparing for this as well, but it became really clear that wearing a mask initially was very socially unacceptable. When you'd walk into a store and you had one on, people looked at you as if you were sick. But that is no longer the case. It's more socially acceptable if you are wearing a mask. You're being respectful to others. So please, if you can help us be part of the solution, I ask you to do so. We as well have seen our all-time high. We have over 20 patients hospitalized every day this week that are positive. We have built units in our emergency department that isolate patients that are suspected, and they are equipped with HEPA filters that recirculate the air safely, as well as our staff are wearing all the personal protective equipment that is needed. However, we've actually created another unit that is specifically for people that are positive, and all the staff are safely treating those patients in that unit. We've had to go to a surge which has another beds that we are actually at capacity. So we were 4 patients away from being full this week at one point, and so we've created a conference room that has 8 gurneys in it to take care of non-COVID patients. So it's working with the county and our elected officials and our state officials that we come to you and ask for your help to be part of the solution. So thank you. I'll be open to questions if you'd like more details, but thank you for this time.
Thank you, Gary, and thank you, Donna, for giving us those medical center updates. I would now like to welcome to the podium our Sheriff, Mike Boudreau.
Hello to everyone. This is your Sheriff, Mike Boudreau. I'm here today to reinforce the importance of what our medical field has been explaining for months. I know that there is a significance on some of the words that I will speak here today in regards to enforcement. I have said in the past, and I still believe it to be true today, that law enforcement's function should not be to cite or arrest those not wearing a mask. But let's not take away from the fact that because of that, it undermines the importance of what our good doctors and medical field has said. We do need to wear our masks. We need to be a responsible community. In the sheriff's office, we have close to 1,000 inmates in our jail, and we have taken a very robust stance in making sure that we're providing medical services as well as good, responsible distancing and recommendations from the governor's office as well as our medical field. Recently, we had 13 inmates that tested positive. We had a quarantine plan in place. We had robust medical screening that was in place. Our staff was wearing masks. The inmates going to court service would wear a mask. Despite that, 13 inmates tested positive, which tells us that even with good due regard that this disease can make its way to the human body when we don't know when it has happened or at what time it has happened. So because of that, I urge our community to let's wear our masks. Let's do our part. I don't want the sheriff's office to take on the role of citing people, but I do want to take on the role of an educational enforcement effort. So let me tell you what the sheriff's office is doing. We have decided that as we go for calls for service, what I have asked, and I've reached out to our CAO and Board of Supervisors who completely support, that when we do go for calls for service and find that people don't have a mask or are not wearing a mask, that we take an educational approach. We have created flyers which talk about the importance of wearing a mask, when to wear a mask and why to wear a mask, who should be wearing a mask. And we're also handing out free masks to anyone in the community that wants one, anyone in the community who doesn't have one or hasn't had the opportunity to be given one. I can tell you that it's important for everyone that's listening now as well to understand that the sheriff's jurisdiction is the county jurisdiction. We have great elected officials and police chiefs throughout the county who are responsible for the enforcement efforts that they deem fit within their government for those cities. The sheriff's role is for our county jurisdictions. We have small townships, we have communities that I represent, and we have done a great deal of effort in education. I'm very happy to report that our communities in the county jurisdictions are practicing safe social distancing. They are practicing good efforts with hygiene as well as wearing their mask, as we see. The other that I see is when we go into the communities, our businesses are providing masks to people to wear. I think all of us understand the importance, and if you don't get it yet, we're asking that you get it today. We as a community of elected officials and people in leadership, we truly believe that this effort is one that we all have to take on together. I know there's a great deal of separation in deciding, do we wear a mask, do we not wear a mask? Is it an enforceable issue? Is it not an enforceable issue? Folks, I'm here to tell you that this has nothing to do with politics. This has nothing to do with your perceptions. It has nothing to do with maybe your personal belief system. This has to deal with us as a community doing whatever we can to provide a safer community. If you don't believe a mask does anything, well, our medical experts are saying that it does. Let's rely on trusting our medical field to wear those masks. So again, I don't want to have to change gears and become an enforcement arm. But I will say, as your sheriff, I will assist any code compliance or any law enforcement agency that comes into the area for those who are in flagrant disregard. For example, if we had a bar, for example, in the county jurisdiction where alcohol, beverage, and control came in to give a citation, we would assist allied agencies' request for assistance. I would hope that our entire community takes on the responsibility of the next 3 weeks minimally to wear those masks. And again, as sheriff, I want you to know that the personnel that work for the Tulare County Sheriff's Office, we live here. We are in your communities. Our children play sports with your children. We go to churches, we go to park events, we go to community events. We are part of you. This is a very stressful, intenseful time for everyone. We understand that. And no more so now than I've ever seen the separation. But now it's time that we take a deep breath. We come together. We come together as a community. We take the time to wear the mask to get over this hump. Me more than ever, I would love to see us get into a flattening of the curve so that we can go to football games together. We can go to the movie theater. We can meet and have dinner together, but now's not the time. Now's the time that we come together and wear masks. So again, let me just reinforce this. I, as your sheriff, don't want to have to cite anyone for not wearing a mask. I think that the people in our community understand their responsibility and their role. But please don't take away from the fact that because I say that I don't believe in what our medical staff is saying. I believe it. Just 2 days ago, I had a family friend that died from COVID-19. I believe it. But I do feel that it's the role and responsibility of our good citizens to go ahead and let's wear this mask. Let's get through the hump. If you don't have one, the sheriff's office, the people at the sheriff's office, I as your sheriff, we will give you one free. We will provide you pamphlets both in English and in Spanish and other languages throughout our county because we have a very diverse county. That we provide you the education so that you understand the importance of this. So I ask, as your sheriff, come together. Let's take a deep breath. Let's take on the role and responsibility of good citizens in this county to respect those around us, and we get through this together. I want to thank you for your time. Thank you to the people of Tulare County.
Thank you, Sheriff Boudreau, for your support. At this time, we will be entertaining any questions from the media for any of our partners here. So, Carrie, do we have any questions? Thank you, Sheriff Boudreau, for your support. One second, Josh. We will be entertaining any questions from the media for any of our partners here. So, Carrie, do we have any questions? We are on a slight delay. Questions from the media for any of our partners here. So, Carrie, do we have any questions? We are on a slight delay. Are we still muted? Okay, with us, folks. The one thing we have learned over the past 3 or 4 months is technology, but maybe we need a few more months to learn a little bit more. So we are having some callers, some calls coming in for some questions. Hang with us, please. Okay, what we are now asking, rather than having the callers call in and speak, if you could send a message via Facebook Live, state who you are, what media outlet you are with, and then our public information officer will see those and get back.
We do have a question from a media member, from John Elliott with Three Rivers News for Sheriff Mike Boudreau.
Sheriff Boudreau?
Sheriff Boudreau, Three Rivers News would like to know, with a daily spike of COVID cases to the highest levels to date, can we count on the Sheriff's Department to enforce the public health orders to protect the citizens of Three Rivers from the hundreds of visitors from all over the U.S. conveying daily to visit the partially open national parks?
Hi, John. Yeah, I know John, and I really love the community of Three Rivers. I visit all of our mountain communities 2-3 times a year, and even most recently, in the last few days, I drove up to Three Rivers and then up over the top. I know the concern, especially with people coming from out of county into the community of Three Rivers, and so that's why we have taken on this educational role and format as to the Sheriff's Office. We will definitely, if called upon, if we see people that are in flagrant disregard, we want to take the educational approach. We want to provide a free mask. We want to be able to provide them with literature, reinforcing that. And so I would stand with John that we're going to enforce an educational position of enforcement. Again, I don't want to be the person giving citations, but I think with good educational reinforcement, by making sure people are clearly aware that you not wearing a mask is putting others in danger, that we will see compliance. And that's really the position that I would rather take. I have seen, for the most part, in our county, people being compliant with, and compliance kind of a strange word, but following the medical recommendations as to mask. And so, John, if I'm hoping that answers your question. I believe that we should take more of an educational approach in our enforcement efforts. Thank you.
Next question is from the Visalia Times Delta. Have any cases been traced to protesters?
Okay, the question is, I saw on Facebook that some folks could not hear the question, so it's from the Visalia Times Delta. The question is, has any of the positive cases been traced back to protesters? Tim, would you like to take that question?
Thank you. That's an excellent question. One that also is challenging to get through, and really is something that we're trying to identify through contact tracing. We have not seen at this point in Tulare County any significant cluster of cases that have been tied directly to protests. Again, that's not to say that people who might have been engaged in protests and activities might have come back positive, but we also don't feel that there was a large outbreak as a result of any of those protests.
Thank you.
Next question is from the Visalia Times Delta. As the Porterville Development Center, is it ready to accept patients, and has it been used?
Okay, the question is from the Visalia Times Delta. Has the Porterville Developmental Center, which has been readied as a surge location, is it ready and is it being used? So Tim, again.
Thank you. Yes, the Porterville Developmental Center is a key alternative care site for not only Tulare County, but some of our regional counties such as Kern, Kings, and Fresno. Our hope is this morning that the site will be up and running. It was staffed yesterday. The staff were waiting for a couple of key logistical pieces like supplies of PPE and making sure food vendors were there to be able to provide meals to those in the facility. Initially, there will be 50 beds available with a capacity to ramp up to 150. Depending on how quickly they begin to fill up, will depend on how quickly we would be ramping up to that 150. But the plan is to work with all of our area hospitals to identify lower acuity individuals that otherwise would have been discharged to skilled nursing facilities or other assisted living facilities, but instead have them transferred to the Porterville Developmental Center for the remainder of their care. That frees up critical beds within our hospitals to address higher acuity individuals.
Carrie?
Yes. The next question is for the hospitals from KC24 News. With the rise in hospitalizations, are patients older or across all ages?
Would you repeat that one more time? It's from KC24 News.
With the rise in hospitalizations, are patients older or across all ages?
With the rise in hospitalization, are the patients older or across the board in all ages?
Yeah, that's a great question. Early on in the pandemic, when I mentioned that we were running a daily census of COVID-positive patients, around 35, for the most part, almost all of those patients were elderly patients. And so I'll say, without offending anybody, maybe age 65 and older. And certainly all of the deaths that we were experiencing were older patients that oftentimes had underlying comorbidities. While at the same time, we probably have collected close to 10,000 specimens since the beginning of the pandemic, and it's been pretty much across the age spectrum. But now we are definitely seeing an increasing proportion of those that are testing positive are younger than age 40, high percentages that are younger than age 25, and of those 51 patients that we currently have in the hospital today that are COVID-19, I would say about half of them are less than age 60. Definitely dips into the 50s, the 40s, and even the 30s. Oftentimes the virus will manifest itself differently in younger people than older people, but what we are experiencing right now is pretty much an even split between what I would call older people and younger people.
Thank you for the opportunity to answer this question. So similarly, we are also seeing that initially it was those that were older than 65, but in this recent week, we have seen the ages between 40 to 55 to be very, very sick. So although this, I didn't mention it earlier, but this virus is something we can't see, and as it manifests differently in each individual, people with diabetes and underlying health conditions like congestive heart failure and various illnesses that they live with do become very, very sick when they do test positive with COVID. So that period in which they recover does take a significant amount of time. We've seen where the intensiveness of these patients, regardless of age, does take sometimes even 2 nurses to 1 patient to just try to stabilize an individual. So although the age question comes to play of how many patients are, what is the age group that are hospitalized? What we're seeing that there are those that are testing positive that are able to stay home are still very sick. So we can't underemphasize enough that it is hitting all age spans. Thank you.
This question is
Sheriff Boudreau?
From Foothills Sun Gazette, where can people get masks from the sheriff's office?
Where can people get masks from the sheriff's office?
You know what, you can either come by any of the stations, or if you ask for us to come and deliver, we'll do so.
So the sheriff's answer is from any of the sheriff's substations throughout the county, or if you contact them, one of the deputies within your area will deliver masks.
That concludes questions from reporters. We have 5 from Facebook.
Okay.
So Facebook Live question. Is it possible for a person to test positive multiple times? If so, are those counted twice as cases?
Tim, would you like to answer that?
You want to repeat it to me?
Yes. Would you repeat it one more time, Carrie?
Is it possible for a person to test multiple times? If so, are those counted twice as cases?
So is it possible for people to get tested multiple times, and if positive, are those cases counted?
So we have with us today on the line a couple of our experts within Health and Human Services. What I'm going to ask is Dr. Sharon Minnick, who is our lead epidemiologist, if she could help field that question just so that I don't get it wrong, and recognizing that we continue to learn more and more about this virus on a daily, weekly, monthly basis, and information changes. Oh, and she's actually going to join us today. Thank you, Sharon.
I'm sorry, you might have to repeat the question. I didn't quite catch all of it.
Is it possible for a person to test multiple times? If so, are those multiple tests counted as multiple cases?
Yes, here in Tulare County, when we calculate our positivity rate, we only include positive cases one time, and for our confirmed cases, we only count them one time. However, people do certainly test positive more than once. You can test positive extended times during the course of this illness. But at this point, we would request that people not try to test multiple times because, as we've probably said already this morning, there's a lot of, the labs are being overwhelmed. So if you know you're a positive case, you should be staying home, following public health recommendations. Thank you.
Thank you, Dr. Minnick.
A question from Facebook for the hospitals. Can the Visalia Convention Center be used for overflow?
So I'll point this one to Gary. The question is, can the Visalia Convention Center be used for patient overflow?
Yes, thank you. So early on in this pandemic, and kind of echoing the sheriff's comments, it's been wonderful to see how the community and all the public agencies and organizations throughout Tulare County have come together to work for a common, obviously a common outcome. So early on in the pandemic, Randy Groom, the Visalia city manager, reached out to me right away and said, Gary, anything we can do from the city standpoint, just let us know. And we did talk about the Visalia Convention Center potentially being one of these alternative care sites. But again, while we were having those conversations, that surge that we were expecting never really came. So again, you saw in New York, they brought in the huge Navy ship. They did convert a lot of non-conventional sites to alternative care sites and actually housed patients. Fresno County actually set up an alternative care site in their convention center, and they never opened it. And in fact, they've now closed it, although we've seen that Fresno County is having a significant outbreak as well, so they may reverse that. So right now, the Porterville Development Center is really the only alternative care site for Tulare County, but should this surge continue to escalate, what we've seen over the last week, then we would certainly look to the convention center. I've spoken to Brent Calvin, the president of the College of the Sequoias, if necessary, taking some of their large lecture halls or other facilities and potentially using those as alternative care sites as well.
Thank you, Gary.
Another question from the media. Have surge protocols being activated right now in the hospitals? And hospitals concerns they're reaching capacity?
So has surge protocols been activated in the hospitals, and are hospitals concerned that they are reaching capacity, I assume with COVID-19 patients? And the media outlet, Carrie, was KC24 News? Huh?
Yes, in regards to our surge capacity, this was actually something that we did early on in March, where we identified, and working with the county, we reported the number of additional surge beds that we could have ready and made into the ability to care for sick patients. So we, working with the California Department of Public Health, had a specific unit that was not part of our licensed beds, and we, with their acceptance, have been able to use that 8-bed unit specifically to treat patients with known positive COVID. So we have been utilizing surge beds for months because they were outside of our licensed beds. However, we have additional surge beds available, and we report those bed numbers on a daily basis to the county, as well as many other daily reports that we report up to the state as far as our bed capacity. So that's our response to having surge beds available for this increased capacity.
Another one from the media, Foothill Sun-Gazette. How much do we need to decrease in cases to meet the state metrics to reopen businesses?
So from the Foothill Sun-Gazette, we have how many cases do we need to decrease to meet the state metrics?
So that's a somewhat complicated question in so much as what the state is identifying for the counties that are on their monitoring list is a number of different categories of metrics. Case rate is definitely one of those. The overall positivity, that is, of all the tests we take, and then those that come back positive, that creates a positivity rate. The state looks at the positivity rate. Those numbers are rotating, or I should say, moving on a 14-day average. So what we would want to be seeing is a positivity below 8%. Our positivity has been, and it looks like staff are, appreciate that, thank you, putting up what our positivity, our percent positivity in the tests per week graph for you to see. The state's threshold is needs to be at or below 8% as one of those metrics. The other metric that we need to be reducing is our hospitalizations. As our hospitalizations increase, that continues to be in the dangerous territory. The state wants to see stable or ideally declining hospitalizations. So it's difficult to say an exact case number, so much as it is a combination of all of those types of efforts. Are we doing testing? Are people who are testing coming back negative, so we're keeping that positivity low? Are we able to maintain stable or declining hospitalizations? And those are the factors that we look closely at that do change every week, and it is a rolling 14-day. So it's difficult to give you an exact time or a number.
This question is from Facebook. Where can someone get tested, and is any same-day testing available?
The question is, where can people get tested, and is same-day testing available?
So there are a variety of locations that people can get tested throughout the county. On the Tulare County's COVID-19 page, there's a section that'll show exactly all of the different locations in the county that are doing collections. We have state-sponsored OptumServe sites that are located in Porterville and Dinuba. Those sites, anyone can sign up, asymptomatic individuals or those that are symptomatic. And then working through your primary care, going to or working through that primary care, they can make referrals to get a collection if they can't do it in their office. Our hospitals do collections, again, based on physician recommendations. In terms of same day, for the general public, there really is not a same day option. Coming into our hospitals, a lot of patients would be before surgery or other procedures might be tested with a machine that can give us immediate results. But even so, we would probably follow that up with a traditional test to ensure that that person is negative. I thank you.
Immediate question from the Visalia Times Delta. Is it possible to see a return of a stay-at-home order in Tulare County?
The question is from the Visalia Times Delta, and the question is it possible to see a return of the stay-at-home order for Tulare County? I'll answer that one. Certainly it is possible. That's why we are stressing today to maintain your social distancing, wear the masks, do not gather with large social gatherings and whatnot. That's what we're trying to prevent today, is having to go further into a dimming of the switch, as they're calling it, rather than moving forward to opening our economy and our businesses and getting life back to normal.
Next question from the media from the Fresno Bee.
Fresno Bee.
The state has said outbreaks at skilled nursing homes are the reason for Tulare County being on the watch list. What is the county doing anything new to address nursing home outbreaks or more testing?
So the question is that it's being said that the nursing home outbreak is what is putting Tulare County on the watch list, and the question is what is being done to avoid the nursing homes from having more COVID cases.
So nursing homes have absolutely contributed to our case rate, particularly early on, where we saw some very notable large outbreaks at a number of facilities across the county. We do continue to see new outbreaks, but I think it's important to stress that our total skilled nursing facility residents make up less than 15% of the positive cases that we're seeing. So while nursing homes might have been an initial driver or area that we saw a lot of growth, they are not where we're seeing the current large rises in cases.
Last question, Supervisor.
Okay.
This is from a Facebook comment. Wasn't the heat supposed to kill the virus?
I'm not a scientist or a doctor, and I don't even play one on TV. That's what we heard. I mean, that's what we hear with the flu and whatnot, but I am going to give that to maybe Dr. Minnick. Would you like to answer that? Wasn't the heat supposed to kill the virus?
Certainly that was everyone's hope, that heat would kill the virus. We all hoped that really hard. Unfortunately, we can't make our plans and live our lives based on hope. So what we see now is the reality, and the reality is that heat does not seem to be lessening the infections. So we're going to need to stay vigilant all through the next periods until we have a vaccine. So please, everyone, follow the public health recommendations. Thank you.
All right, well, that concludes our questions today and our press conference. First of all, I want to thank everyone for taking time out of, I know, their busy days to be here. Sheriff Boudreau, thank you. Gary and Donna, thank you from Sierra View Hospital and Cuyah Delta Hospital. Tim and Dr. Minnick. We're going to ask that you please follow the public health guidance recommendations, especially this weekend as we celebrate Independence Day. And I know it's kind of ironic that we're celebrating Independence Day and our freedoms as Americans, and we're asking you not to congregate and to get together and to wear your mask. But I just hope that you heed this advice, you heed the recommendations of doing so that Tulare County can move forward in a healthy way, get our economy and our businesses back up and running the way they should be. We're all in this together, Tulare County, and it'll take each and every one of us to stop the spread of COVID-19 in our county. So please do your part, socially distance, wear your mask, wash your hands, and have a safe and sane holiday. Thank you very much.